Hi everyone, we're back for part 3 of eyes, and so let's start with the injured eye. Corneal abrasions are damage to the epithelial cells of the cornea. It's fairly common. It can occur from many different things, such as a forceps delivery to a piece of paper that brushes up against the eye, hair brushes, makeup brushes, fingernails, contact lenses, overuse, airbag deployment, plants or foreign bodies that might be found in the conjunctival sac. Clinical findings may be sensation or evidence of a foreign body in the eye, severe pain to the eye, sensitivity to light, tearing, decreased vision, redness to the conjunctiva, and fluorescein staining is beneficial to help visualize the tear. Referrals for severe corneal injuries are required. If there's no symptoms of corneal infection, using a topical antibiotic such as an erythromycin or a polysporin 4 times a day is prudent. It's important to prevent rubbing to the eyes. The use of a patch does not improve healing or decrease pain, and a poorly applied patch may even cause further issues. Abrasions are generally healed in 24 to 48 hours, and you need to advise the patient to return daily for follow-up evaluation or refer to an ophthalmologist for a slit lamp test within 24 to 36 hours. It can be uncomfortable, so oral analgesics or eye NSAIDs such as Toradol may be used for eye discomfort. Foreign bodies, if superficial, rarely cause any serious trauma. They can be painful, have an unusual sensation. You can have increased tearing, inflammation. You can have irregularity in the pupils, sensitivity to light, opaque lenses, and if there is a perforating wound, you can see that in the cornea or the iris. Some diagnostic tests that we would use to rule it out would be ultrasound or CT. Management includes not removing the foreign body. It's important that the object be left in place and you refer them to an ophthalmologist. You can use a topical anesthetic if necessary to get better visualization of the area. If you're not able to visualize anything but suspect that something is there, you can attempt irrigation. Definitely irrigate if visualized. If unable to determine anything, that is definitely time for referral. Let me just backtrack and clarify a little bit. Not to remove an intraocular foreign body. Now, if you see, a hair or a bug that's floating in the eye, of course, we'll remove that and irrigate. But if you're seeing something that you're unable to remove, then refer that immediately. And if an airbag has been deployed, it's important to irrigate thoroughly to get all of the powder or substance out that is seen with airbags. Complications of a foreign body may include sympathetic ophthalmia, chronic cytorosis, and uveitis. Burns to eyes can be from heat, chemical, or UV light induced. Some clinical findings may include pale or necrosed appearance tissue. There may be opacity of the corneal tissue. You may have vision issues, pain, tearing, swelling. Management is going to include a topical anesthetic to help with the pain. For chemical burns, you need immediate, ongoing, and lots of irrigation. For thermal burns, you would do that as according to corneal abrasions. And if you have some UV burns, then a topical antibiotic could be used with patches and analgesics. In the book, there is a section in the burn area that talks about irrigation and trying to establish pH values of the fluid that is there. So lacerations of the orbit, you could have a perforation of the cornea, uveal prolapse. This can be found in the anterior section, so you may have an irregular pupil, iris, or have an iris prolapse. In the posterior section, you may have poor red light reflex, decreased vision, or any black tissue under the conjunctiva. Management includes an eye shield to protect the eye, and for this you refer immediately to an ophthalmologist. A traumatic hyphema is accumulation of visible blood in the anterior chamber of the eye. It's usually caused from a blunt trauma or a birth trauma. Clinical findings may be traumatic eye injury, somnolence if there's some intracranial trauma, dark red fluid, no red light reflex, pain, sensitivity, tearing, visual acuity changes, and you may have some abnormal papillary reflex. Management includes a referral to an ophthalmologist. You need to restrict oral intake until it's been visualized. A perforated eye shield is appropriate to put on. It can be managed in the outpatient setting if mild. If it's severe, the patient is likely going to be hospitalized and surgery may be necessary. So some complications are always to look for the possibility of a second hemorrhage and any vision loss. In a retinal detachment, the retina can pull away from the epithelial base. It's rare in children, and if it is seen, it raises a high suspicion for abuse. Clinical findings may be blurry vision, progressively worse vision, dark cloud in the visual field, flashing lights, darkening of the vessels on eye exam, and management is to refer immediately. An orbital hematoma or a contusion of the globe is usually from a blow to the eye. Clinical findings may show a milky white appearance of the retina, visual acuity changes, bruising of the external tissues, discoloration of the lens, retinal detachment or swelling to the area. Some retinal hemorrhage, rupture could even have rupture of the eyeball. This is a refer immediately, and complications could be permanent vision loss. For orbital fractures, those are usually secondary to a blunt trauma to the eye. You might see pain, double vision, numbness below the eye, bruising of the eyelid, a nosebleed, limited movement of the eye, displacement of the globe, corneal laceration, irregular pupil. These are all, and decreased red light reflex. These are all things to assess for if you are noting to have a trauma to the, or a blunt trauma to the eye. Diagnostically, you might do x-rays or a CT, and for an orbital fracture, this is considered an emergency state and does require a referral. All right, pterygium is a fibrovascular mass of thickened bulbar conjunctiva that extends into the cornea. It's in the shape of a triangle and is usual on the nasal side of the orbit. It can be painless, but it can also be itchy and can cause blurred vision. If that is present, you need to protect against irritants to the eye, and surgery may be necessary. It is not common in the kids, but refer to more information on this in the book. For a subconjunctival hemorrhage, you can have some blotchy conjunctival redness. It can be spontaneous or can be from increased intrathoracic pressure, such as blowing your nose, having a forceful cough. It's usually painless and resolves on its own. No treatment is needed unless there's pain, vision loss, or photosensitivity. An eyelid contusion, such as a black eye, is usually from a blunt injury. You will notice bruising, swelling, and ecchymosis. You may note pain, decreased visual acuity, double vision, flashing lights. It's important to rule out if there's been a more serious injury. And lastly, deformities of the eyelids. Entropion is an inverted eyelid. Ectropion is an eyelid that folds out. And eubliferian is a wide it's been a long video, guys, palpebral fissure. This fissure is the space between the medial and the lateral canthi of the two open lids. So in essence, it's the opening between the two eyelids. Okay. I think that wraps up chapter 29. I appreciate you listening, and thank you.